Anyway, busuafo and then so yasana share mamu nyina kwa ba edemoba Lily M TV show na dwumadi ayeye de no ane my health checks ne samra ne so eka ho ne saving lives na me doctor so a je bia oje na dwa ya otu ne ho ache Dr. Bobson Ateko na dwumadi ayi de ade ade bia me busa ene se enti ya na wankasa o de ho kọ doctor ho say on hwehwe wapom mamu ana wankasa de ho kọ doctor so doctor ene maba say me hwehwe wapom di mu asem anya bia wo yesa say wonya sa de a na my health checks ene ya trase e bebo won ka yese wapom din eno ane won kwa eno nti hwehwe wapom di mu nsem na dwumadi aye di doctor wo kyerɛkyerɛ yɛn yade ahodoɔ ya ɛha nipa na sɛ wotena wɔn so na wɔntu wapɔmuden ho anamɔne a na wɔn so akɔte yade bi ama ho nti ayɛ sɛ dwumadie ɛbɛbɔ wɔn ka yɛ bɛkyerɛkyerɛ yade ahodoɔ ne sɛ deɛ teɛ ho kyerɛ nsunsuaso a ɛwɔ soɔ ɛne nnuane nnuro ne nnuane mpo ɛsɛ wodie ɛno na doctor ɛkyerɛkyerɛ yɛn said be ye nyina be hwe apomodin ho yie na yenya nkwa tentene ya ahoden wo mu na ye ho aba mfaso ama mansan na ye ne ye kase ye twahie mu ye fie ye busuafo nyina nso enya ye so ye ho mfaso na busua dwumadi me nkwa me ntime nyo ai me se oba ne no watumi ayo sabi ese ebe no so a na ye mia eno nti me wo adwumaku a wonu mada wo ma na omodom me so masene ma metumi de dwumadi e de brewo Golden Palace Hotel Limited. Golden Palace was a Manchester Jamestown. A one so and a Lily M Palace Event Center. So event center. As a Manchester dear, but be anyone mother to Lily M Palace Event Center. Event center as we view ho. A ho that din the one so effect home. The host song. Biano just a woman sa. Your conference room. Air condition bibia tuatua nkonwa papa ye wo enkwankwa nuase ya to ne di say boni be se garden mu ya ye local environment akotena ho ma you breathe chlorophyll no wonya hoden anasa pomudin a emu odene na ye o main hall so ya chese ho so kama nsam bia wo pe bia no wo ba mfa mfiri ba bi ma Golden Palace be ma bibia nsam bia wo pe bia no wonum the Bemau Golden Palace ewo Asamankese Jamestown meti die so wa was na pink no masako kam na etija ai pink papa pink a say we pink a say we girlish no hairport salon na hairport salon die omonkra bata no say papa na ya de ama opanyini George wa ya de say owo bia e bebre wo sabiyo nkran krom ha sei I make a kakra bia na bi wo Madina Firestone ebi wo Kwabenya ebi wo Pokuase ebi wo Dome ebi so Mamprobi say ebi kwa wo bebre I mean to me kwa modin I just say numbers na e twagu screen ase no wo de fa na frɛ hair salon nya short hair ne color hair kwa no mo ye dreadlocks so etre bia wo ye be ma wo ye oba wo kɔ hɔ a ono be siesie ma oho ayefe which are Steam Limited, any Steam group of companies. Yeah, Steam report come on Bomi Chidom. Juma Mudi Dawson, entertainment, woman, acquire your near dance here, one woman, or perform for two swa, on the mouth. Or numbers, I was been as Bomodia sell befa, now a flow mona or Madomaya or moi. It was your Lily's bead herb. Lily's bead, I want to call a simple, very simple bead. Very simple and classy bead. Open all kinds of bead production. Open fresh Lily's bead have be one open bead actually tie atu the call mo bu ne nine. Open bead e bu asinimu bead ada efa bead ho bia no. But modern efa Lily's bead have. Na Lily's bead have so onya o kama na me call mo aye kama. Onso de crampo e me cheme. Abusua makase se obedwuma de so a Lily MTV I watch YouTube so on the four oba because once subscribe page here dwumadie a kama kan wo ba obi ntibi na wiase so wo ye pesa me nkuminya so wo nim say nye so wonya ade a wo che no bi aso nya bi na obi anya ho faso and so ba just like this page, subscribe it and share it so that others can also reach out, or reach this page and also learn from the page. Oko TikTok so Lily M TV, so also na Facebook so Lily M TV, Instagram Lily M TV. Oko the America ho another one ba eka meka na chire na won so hu but the ma boy nyina no Lily M TV ni nyina Lily M TV o ya o betimi hu ne ye na so wasua mu ade chire me the last one no ebebre mu na won so watimi subscribe and also wa like na wa fan so share aka ho ebusua ene ade a ye besua ya ade a beka ho asem aya yade a afa kura no wayi ne tie yade afa no wayi ne tie a me no kasei ya ahwe ne yie ni ahwe ho so yie a ahwe yie a yade ne betu atese man mu hasei enu nti na chese doctor eji amerika abase enne de maame meka ho asem na me fa mo nkrofo kokko na obi anya ahwe yie se de be ya wankote ya de bonni bi a afa na yi ne tie yi na wan free atiasefo asase so ntententem para the doctor abase wo te ya pe ohunu ya pe oso ntena sekura o ba tv so no abeka mo asem na ye nyina nso etie ne asua mu ade afa me ankasa me doctor brante kwa de bia me ka me friend na brante kwa je so ya brante mu no and de bia otu ne ho asi wo se obeboa na dwumadie yi obeboa no wa kyerɛkyerɛ yɛn yapɔmudin mu nsɛm na yɛhwɛ yɛn ho so yie sɛ deɛ medical Canada nanso me sense so dua sɛ me doctor honorable Dr. Bobson Ateko and nso wadom me aba fidua mu ha abɛsra yɛn doctor me mu akɔ aba
that's your very
mo akɔ aba so nko na bia mka sɛ wo ma me te hyerɛn wo so na bia na wo so te hyerɛn kakra bebe nya kakra doctor yo ya da se pare nso aba that's bebe na se dem aka no ene ne yade a afi na ayi ne tie me mom de na mente kura da fe na mate se ayi ne tie ya won so wote ya wo de wo ho prepare so pese oba na oba kyerɛkyerɛ ahwefo na obi aya hwɛ yie soronko ya se fe no Lassa Fever na Lassa Fever no de yade a na ne ho ayi hu sesi asa
so Lassa Fever no so dey can no hemorrhagic fever yenya free mboa zoonotic nti mboa bi to say rodents basically rodents na wonya free nti rodents no rats the specific rodent is rats wonya free rats so there are specific species of rats which is very dominant in West Africa yeah area how say na usually transmitted or now say host for the virus so the virus goes in such host rodents nti they are usually the natalensis rats no natalensis
natalensis that type of rat na omo yade no ba no
what happens is that like first no na again say from just the rat to the humans but there has been human to human transmission too as well so aside from rats to humans there are cases of human to human transmission that is obi awenya bi no if it comes into contact with a person's blood or bodily fluids na also to menya bi so basically how you get the virus is from the rodents so when they come into contact with our foods or items na omujun so guso and amot afrita so no omo toilet go yejuane so na yeso yedi njuane na basically that's how we come about yetumenya virus no nti sisi enye yare fufuro it has been there since the 1950s but the virus was first identified in 1969 in Nigeria in a town in Nigeria called Lassa free they are already about Lassa Fever.
Lassa not free Nigeria.
A crew Nigeria.
Oh, I see.
So that was where the virus was first actually described. But like according to genetic studies, like it has been in existence since the 1950s. But 1969, and Nigeria. In Nigeria, they affected two nurses were ama bakukra uye. Nigeria.
That was the 1969. Now
1969. So nurses ni like ideally not more rural area or rural area. I was more transported to the city for treatment. So when it got to the city, it died. So you go to the city now, two other nurses in the city also got infected over there. And Bakusu Ephraim, and the Akano, or no more than New York, and a country, you know, the one more isolated crown home say Lassa Fever, now when you know. Unfortunately, you know, scientists now more share no, one of them died of the virus in Komu Bako.
Wow.
Emeka Bako. And a Bako, no, Nigerian lady, no, ne blood sample, immunological sample, no, NMDGT, or no. So it's like it's the case fatality is high. It's very deadly. So especially if you don't see it early, it can easily cause fatality.
I see. It's not just 1969 and they discover and I'm describe it as a dear. Now so who say and on as a quan bang now be who say saya dear when you say about the science bang and me
okay.
Na DNSME.
Okay. So that I'm making I got some of these cheap ways like it's endemic in a lot of West African countries.
Okay.
Basically West African countries. Ghana Ghana discovered the first case I think somewhere 2011. But yeah, recorded bioma besi.
And 2011 the Ghana
recorded cases but other countries too is endemic in Nigeria, Togo, Sierra Leone, Nigeria cry one of the highest the prevalence is quite high in Sierra Leone and Nigeria.
I see.
Liberia, Mali. So these West African countries need to be endemic over there. But in Ghana, it's also endemic here, but we don't record a lot of cases.
Okay.
But recently, I recorded 2 cases. But one of the general symptoms, one of the earliest symptoms now being like you have fever, that is increase in temperature.
Okay.
Not general body weakness. Now the other symptoms continue. So there's headache too. There's severe headache. People get severe headaches near the headaches now. Then it translates to the now fever and so muscle pain. Muscle pain. So you begin to get muscle and chest pains too, and so nausea. And so also vomiting. And we share these symptoms now. It can easily be misdiagnosed. You can easily see it mimics other common infections such as malaria. So if you do not take care, you may assume say malaria fever now. So like you try to target malaria treatment, but it may be the Lassa fever no. But in severe cases, no, and they present you with the distinct symptoms where you may be bleeding from your nose, your mouth. Sometimes like your vagina, crow your bar, and bema so moja to me free or bema so eba that kind of thing. Yeah, severe sana. Sometimes it can also cause deafness too. So usually the deafness no permanent because it's permanent deafness. So as soon HMAC as a result of the infection. So like fatality. So for now, worldwide the fatality is like 1%. But 1% it looks very small, but on a large scale. So you can't the number of cases in worldwide now calculating 1%. I know that a lot of people are dying. And then like in Africa too, they didn't have a lot of data with the epidemiology in Africa. But almost estimates here to say about 5,000 people die every year in Africa from this disease. But just like data but based on extrapolations, they can predict say about 5,000 people will die every year from this infection. But just as you have
I see. Nti so they okay. Now Africans, especially me am here. So as symptoms here okay there. Me benya malaria, you said it.
Yeah.
Benya malaria, you know, met me akopɛ me malaria dro na manom. Because said the okay can say Lassa fever no. Science dey na sa na malaria tie. Maybe typhoid crash so wait me be out. Nti they say a better pana a dear pan a better stronko. You know, before I get to the bleeding stage, you know, I end there then because said the okay you know, Nigeria for the will be bleeding and only a day. Now, before I get to the bleeding stage, there should be something different. I mean, because you know, the I know APCB.
No.
And malaria drug in my best which is will also be spreading it to other people and it will not be safe. So what will I be able to see differently from what you have said?
Thank you very much. So now that the Lassa fever is on the rise, now you say now the thing is that two people got infected. Like the in Ghana, no. The first case, but the second one, or contact. As that person came into contact with the Lassa fever, no.
Okay.
And also this is like no here, and also a hospital, like almost treating about no here. But they've identified about 56 cases. People are more in contact with the alive in CCR.
Hey.
That they are now doing contact tracing. Do you understand? So sometimes the history is also very important. So the kind of people that if you've come into contact with can be very helpful for us to know, say, if yours is likely to be Lassa fever or not. Another thing too is that, especially with malaria, there's this advocacy that you test before you treat and all. Do you understand? Sometimes you be brain who's the OCR and testing, but CCR now Lassa fever is on the rise. It becomes more important to do the testing. Not just the RDT. After the RDT, even if you test negative, you just maybe do the microscopy in addition to rule out malaria. So if you're able to rule out malaria, and now say even if you have to buy the anti-malarial medication, it's just for 3 days, anti-malarial. So after the 3 days, if the symptoms are still persisting, do you understand? Then you prefer that to get, especially now that it's on the rise in Ghana. You prefer that you go to the laboratories to do the test for the Lassa fever too. So now the big laboratories, Gucci and the rest, they've started doing these tests, PCR tests for the virus. And say the symptoms come, maybe malaria, say, oh no, after the 3 days, the symptoms are still persistent. Like still down or you can prove that to see, say, maybe it is the Lassa fever. Since Ababaye endemic since the symptoms are very similar to and in tema especially with the treatments. In tema the say we starting like it's muscle pain, chest pain, like general body weakness. Now we starting bleeding not usually in severe instances. But as a we starting some of those bleeds, as a was you're hearing function as a suit sometimes because it can cause total deafness and then it doesn't revert deafness, which is permanent. So we starting some of these early symptoms that sort of mimics the malaria now what to handle more. So you do the malaria test and if it tests negative, then you prefer that to do the other test. To Lassa fever test and make sure you are fine. But the contact in here very important. So you may have come into contact with Sani Pakrowe, you can say me not just say or say also we call ahead now test now make sure say you've tested negative. Now say the bear also with me about home by.
Tina say me tiwasia and no name no each and on sense and channel na ebe nya o widie mu no so kakra compared to malaria na wo kana
in the early stages in there if so that so different in the early stages the only thing that may be because in malaria you also get some of these joint pain, general body weakness,
vomiting, nausea, and all those things.
And you get all of those in malaria too as well. This one comes with muscle pain. You feel pain in your muscles and with chest pain too as well. The Lassa fever, you get this chest pain too as well. Maybe that could one way or the other distinguish itself a little from the malaria.
So how fast does this spread and how does it spread? Because the baby only I should me am tears me who nama who Bible SMB. So the council is here in 50 something contacts 56 date when in Ghana
discovered 24th of February and omunya 2 cases some discovered 2 cases about frame
It is say sinus is spread. Can you tell us how it spread?
The main spread is the zoonotic from the rat. So if the rat comes into contact with Ujani, so usually the food that we store, sometimes they are maize, rice, they are stored in the
if
you don't keep it in a rodent proof container or area. Now rodents no rats no have access to it.
Okay.
Now omo have contact with the janina. Who the ye janina or dear? Who mean virus ni bi.
Eja kra can still abenya. This is a virus really on soldier.
Not necessarily. It be crowd you can reduce the amount, but still there are cases of a crano or another rat no come into contact with food. Now you don't know and still you eat and you still get the virus. So you don't have to risk it. Say, oh, I'm going to cook the food until
and I'm hitting. They see my dear
even though we encourage it, but the best thing is to prevent the rodent from even coming into contact with your food in the first place.
Okay.
Until obe di ohuni ofie said the bear mboano entumi emba because omeba ofia omepe ejane crumbs
leftovers na just kitchen basa ya bola si hono mai ya de chenso no
very good enti say bola usually don't dump the rubbish no baby e ben ofie obi ono ma baby omo dump no ni fie na wako dump e ho na say you should dump refuse like in a site usually there should be a designated site which is far from a field. You don't pay your refuse no honum. That is also very important. Now you keep your journey in a rat proof area. Maybe I'll store a journey and if you say in Toku and now can be now and why with me a room Namako juice or juice a good journey so now maybe I could say I'm all no that is one way I'll be to and there's human to human transmission. Say when you be relative be happy not be infected when you are assisting the person you have to be very careful where the PPE is say gloves now be share marks near day. Say the you don't come directly into contact with the bodily fluids moja, the sweat, the urine. Even you see the semen, the virus can also be excreted in your semen. Semen like sperm so your bema na uhunsu uja unti obada krana obano. Even though say that transmission is a little low but still the virus has been discovered in your semen and see body fluids, including semen, crano, obviously they are transmitted. So the zoonotic and then human to human transmission. That's basically how it transmits.
If you free crack coming hona, one ya beer, and as a minimum will be a medemount. The amount. Me Johnson. A cow one. Some accordance or bathroom. Na man flashy. And I make be a good seat in the so.
And I'll be one who say now the abbey a janamo be an abbey or don't have a cocoa be no. According to me, and
there's a coronavirus now in a different form.
It's a virus, but like there are different
this one too is a different virus. Corona anything. Lassa
Fever.
And it's a virus.
So Lassa Fever virus.
Okay.
And we are different from the coronavirus.
Hey, doctor, na just I all can was some deadly ankasa. Na you enkoda ye. Doctor, e kwan ben na and say e be na ya boy enkoda ho ban. Minim say question ni busa we there. Nka doctor ho. Ba minim say ka ho. Say enkola ya Africa na ya de ya ba spread it say they okay spread it so fast. Because any of my fast we dey ban nyina ye di for. Obi e di for man mu. So na say enkoda ye mai we say tifie enso mo de be fi abonte abre yen. E be dey na omonya ho ban bo.
Okay, so this Lassa fever has become an issue of public health interest. There are a lot of organizations, the WHO, Ministry of Health, and the Ghana Health Service. So now measures are being put in place, trying to get more information from the experts. So that they can put a lot of measures in place, even in schools, churches, and other places. So with time, a lot of regulations, especially if the case begins to increase, number of cases begins to increase. There will be a lot of regulations from the WHO, Ghana Health Service, and ministries. Regulations for churches, they said COVID regulations for schools and then households. But until then, for now, you have to maintain very high hygienic condition. And if you store a lot of, especially the raw food products, you have to be very careful where you store it. See, from now you are going to assess the areas now storing, especially and they're very dangerous because they buy the food in large quantity, raw materials in large quantity, normal store, normal using a kakra. And your mom this is the time I would say you have to be very careful with your food. No?
Yeah.
Ensure very high hygienic conditions. Mom ensure very well. And so now they begin to handle the food. When I say they handle the food very well, the vegetables, no, especially they handle it very well, clean it very well. Then say maybe I store you know. I rodent proof such that in acquiring kitten be new bit me akotite.
More bit me a faho.
Room. And I say akotite. So the bell bit me now keep the storehouse no very clean. So the way we don't have some of these rodents no in severe situations no you may have to use some of these rodenticides. So more a lot of in cra and I say rat no if you you have to use fumigate the room, you have to call for fumigation, the exterminators, no mobile fumigate with normal driving out all the rodents, no. Usually, into what we fear and more rats no be brave no. We advise call exterminators and I think the Zoom service and the EP when you contact them, they can come and help you fumigate your house so that they can drive all those the rats out, no. So that by be safe. You born more hormone but more can say normal, but see now the Lassa Fever virus on the rise. I say we 2 normal now mo drive all of them out. Now mo ensure say mo fear no rat proof. Mo close up all the crevices so that way abounding to me any in the realm of.
Okay. You are watching my health checks saving lives, and it's with my honorable Dr. Bobson Ateko. I wish I for so yasane ehia na na e ka ho asel yade a yi ni tifufuru a yade huhuhu yade a okum nipa yade a ono so yi ni ti a opese obetete ya brabo na doctor abafi ha ne se obekyerekere se de yade na tie na yahwe ye ho yie se de be ya yanso yenkonya yade no se wunya pe wunya bi nso anya spread ten enti doctor se nyina yanya hwe yie na Lassa Fever no enne wasane yi neti wo Ghana sesi am no ka say akum nipa baako nipa no ye discover doctor say on the 24th of this month and I discover nipa mienu a baako eto ne aduane ya na aduane no say the doctor kan ya want me am ho ban yie mankura atu atese ho ama wakonya yade nyini a ode afamu ato nanom wo si adui nti wodofo a wo hwe me mesrew say yebehwe yapomu yie na yade yen konkonya bie sa afa no aba efidie so mesrew say subscribe this page, please subscribe this page, and don't just subscribe it, you should share it na onamfofo nso a wonom hia nsempa pa efa yapomuden ho nso no wonom atimenya bia tie okọ TikTok a Lily M TV sanso na Facebook nso so ye Lily M TV okọ Twitter nso a Lily M the icon and na Instagram enso ye Lily M TV before me wo oni a wonda ma onu mbo mi chidom Golden Palace Hotel Limited wasamanka se wanso na Lily M Palace Event Center so wo Steam Group of Companies ombo mi chidom sanso na Lily M and Lily's Bead Hub ono so bo mi chidom sanso na Airport Salon ono so fa mi tiri ho ka ya ntimi dwumade bro fe doctor emo akwa ba bi wate na ne waka nsafa na mi musa question we sa Lassa Fever e ba so nose mask de she ehun no etimi eboa prevent ya na.
Okay, so since it transmitted through the bodily fluids, and he said, everyone said, "Meno kasakra na say me to ebia sebe to show free menu egu ho na me will be a." There's a chance that I can also transmit it because the saliva is also a bodily fluid. But unlike like the coronavirus, it's not aerosol, airborne. It's not necessarily airborne. You have to come into direct contact with the person. Nose mask can give you some amount of protection, but I mean, like, unlike other airborne diseases, when you have to come into direct contact with the person's bodily fluids in order to get it.
Can you just only want if you share the public
use almost share facility,
one toilet, one bathroom.
That is where they have to be very careful.
Just as I'm Cassia Pana, I better Ghana, my mom doctor. She say Ghana waka. So I infection. So who rate Ghana? Say, send a be rate. Say, especially say yade we ya abai where say yade we ya abai say nipa do sen pese osisi dua bio pado do sen na enya pado do sen na ewuo na ye na ya kanso so no sen na ebesi aboye ho ban sisu dua bio na amanfo nsantie obi o afi na waba.
Okay. From information you free Ministry of Health share say so far 2 cases and I confirmed at Noguchi.
Okay.
And out of these 2 cases, no, Bako Ahiri and one of them has passed away. The other one is still alive and receiving treatment. But they are all the person who's alive right now. It has about 56 contacts that they are still tracing.
Okay.
To make sure, because the second case, no, a contact of the first case, we're free, no. So they are closely monitoring this second case.
Okay.
And now they are also trying to contact that NIPA 56, doing contact tracing for these 56 people that may have come into contact with this person.
Okay.
And then because of the number, the 56, I'm sure say each of the 56 too may have some contact. Do you understand? So that's how the spread goes. So you have to. So now the Ministry of Health, Ghana Health Service, like they're all very it has raised public health awareness with the contact tracing. So now they are doing aggressive contact tracing, trying to so that we can limit the spread. So if you're able to get all those who have come into contact with it, you just isolate all of them and then make sure that they get adequate treatment so that they don't spread it to others. So right now, the most important thing is like we're able to get these contact persons and isolate them. So that I almost spread it to other people. Exactly. I can say your boy home by say contact say who will be around just refer the person to the right quarters. I may found and keka some of these symptoms no be just say I don't care for when you and I say be obeying. But you have to have in mind say this is what is going on. Now Lassa Fever is endemic in a number of West African countries. Nigeria, Benin, Togo, Sierra Leone, Libya, Mali,
West
African countries. Lassa Fever is endemic in most of these countries.
I see.
So now it's of public health attention. See, like may not necessarily discriminate against people, but like have it in mind. Say this is what is going on. And be cautious. But I say, because like there'll be a lot of information coming out henceforth. Ministry of Health, Ghana Health Service, a lot of information be coming. The media houses will also be coming up with a lot of advertisements, health promotion. Because the right information from the right media houses, so that the wrong information from another.
So doctor, sign a treatment in it here.
So for now, there isn't any approved vaccine, for vaccine being even though there are people still working on the vaccines, that some are even in human trials, even made through human trials, like with the vaccine, but there's no approved, as of now, there's no approved vaccine. Which means they are born by a freezer virus. And with regards to the treatment, a drew or high, but even with that drug, there isn't any concrete evidence. Say this particular drug will be able to treat it. But there's a drug, and then some studies have shown that almost starting treatment early for you, it helps, because especially that drug, they started using it in the Sierra Leone. When they started getting a lot of cases, so it helped a lot of people, especially those who started the treatment very early. So there's a drug, but I know just say because the earlier the better. So if the symptoms start early and then you report and they start the treatment for you, I'm sure you'll be fine. But I mean, still vaccines. A lot of trials are going on. Say hopefully in the near future, we may get a virus and then in dry immediate treating.
I mean the vaccine. Just a doctor, a man is more deadly.
Yes.
Because you see in your vaccine. So how are you able to? I mean, so the doctor, a company I'm first somebody treaty or more and someone sustain them, because they say you rightly said one of them. I mean the 2 people that were diagnosed. One passed on. And then the other one is still there, and then you've quarantined him. how are you managing? Because we don't have the vaccines yet.
So now what you do is symptomatic management. So if the person comes with certain symptoms now, you ensure that you manage the symptoms adequately. So if there is diarrhea, the person is diarrhea, you manage the diarrhea. The person looks dehydrated, you manage it. That kind of thing. So based on the symptoms now, then we manage symptomatically, you understand? And then we give the drug that I'm saying, the drug that is being used in the management. So with that, so mainly what you do right now is palliative, and I say symptomatic management. That is what is going to be done. But you'll be monitored constantly. Just in case there are some complications coming up, because when it get complicated, it affects your organs, your kidneys, your spleen, your liver. It can affect some of these organs. So you have to be closely monitored and given all the medical support that you may need. So your management is mainly symptomatic, palliative, just to prevent any complications because you need to be monitored closely. Since if it gets serious, now we need health facilities and obviously so if unya virus now, you are going to be well taken care of because you'll be in quarantine and you'll be monitored closely. If any symptom be out there, they will target it, they will manage it, and then try to give you medication to boost your immune system so that you can fight this viral infection. So immune boosting is also one of the major things that you'll be doing to ensure that you'll be able to fight the virus.
So Fatwa Sumai say abane say no obia say the titi in the walking in the lot of phone be so kicking a vaccine and as a virus a vaccine in your mind, you know. And then they were spreading so the one Casancasa said the working who ye. If you say, and you said, when they ran yesterday, na ajo, and tea, and I'm the Sua Mariachi, we ought to be jamming cigars. So the real craft in one moaso. And now by your Google form, Jaunim said, and more bedroom so good. Yes, I didn't know, be to me. That's so cry being hot. Doctor, in your words. Dear now be catching what can be brave all right there, but dear now be catching Ghana for near one more crazy see said the bay a measure your most ye a bay ye. Well, I know say human to human, you will zoo whatever zoonotic free more more soon in Korea and can see a creative environment among one he say almost see a dime where you feel it's almost see mansions where you feel catching in our magic wafer. No more so spreading a dear man. This is why any cures say we don't have the vaccine for it. What can we do again, doctor?
Okay, so for Mr. Tiffy or more, like there are more a lot of rodents if there are lots of them there, I will advise that we start using some of these rodenticides. They are in crano. And I say you can contact the EPA, the veterinary personnel, and I say the Zoom Lion service. So that you can exterminate all these animals from your house. Very important because omufaba. So if
a young crano,
rats
yes, interference a curape and now de yadeiba or bejonso or tentesio or you be a good bianis or Janet Naya. Nina can't at the end patch. I say, come on, idea.
Yes,
I see.
Say, who will be brave fear? I will say, two animals said that you get rid of all of them from your house. And she said, if the house has to be fumigated, if you have to, said those problem. I'll be advised that if you have another place that you can move out so that you can adequately get rid of all the animals. Spray, get rid of all in before you even move back into the house. Or more relatively, maybe you don't have a lot of them in your houses. You start protecting yourself. So check crevices, especially where you store your food, because some people of fear, definitely they would want to come to baby in so especially where you store your food. So when you come to your house, that is where they will come to. So where you store your food, make sure that say your friend rodent proof. Baby, I always might say that say a barrel or katasu said they store some of their grains and their food stuff in barrels. So make sure that you cover it very well. If they are in sacks near there, you know that these animals they can tear through the sack and have access to it. So that you just have to prevent them from even getting into the storehouse itself. And I said, if you have a storehouse for now, I say why you the eco super say these animals, so you have to check for rodents. Very important. You can set maybe traps and other things check for rodents. If you identify the rodents in there, you have to be very careful. Don't touch them with your bare hands. You have to be very careful. So wear the necessary PPEs, and then dispose the animal adequately.
Okay. For and then so yeah, the Jumadi no and every year near Deban. Doctor near here be a fire dear who were canning at that. What canning in our tray. Now, my last question before we sign off. Doctor, when they have vitamins be I bet with your crew now. It was with their palm one every year.
Okay, so
I boost your immune system.
Yes, viral infection. So usually for viral infections, one of the most important management is to boost your immune system.
Okay.
So eating very well, and as I say, very hygienic conditions. So in January, they also say we are always cooking under high hygienic conditions. And I say, baby, I bet your cocoa say the food is cooked and I say maintained as a very hygienic condition.
Okay.
The end of the year with the fruits and vegetables, they are making the multivitamins. So you can get some of these multivitamin supplements. Those rich in the vitamin A, vitamin B, C, D, vitamin E. Vitamin C, very important. So even if you don't get any combo multivitamin, if you have your vitamin C with zinc, it's adequate to boost your immune system.
Okay.
So zinc, with a zinc tablet, you can do dose from 20 to 60 milligram up to 60 milligram for immune boosting. Okay. So you can do up to about 60 milligram a day of zinc to boost your immune system.
Okay.
Zinc is easy to acquire even if you don't have money. It's very cheap.
It's not expensive.
It's not expensive. Very cheap to get a zinc tablet. To start taking your zinc tablets with your vitamin C.
Okay.
So preferably if you can do some of the high dose vitamin C to protect yourself, like 1 gram a day. If you can do 1 gram a day, it's fine. And then zinc tablets. Instead of 20 to 60 milligram of zinc tablets to boost your immune system. If you're able to get other multivitamins in addition, based on your finances, that is also good.
Okay.
But I think one year you cry and your zinc and your vitamin C will do.
Yes, as zinc na de tunsuo no had dey say obia nka de bia de baako tunsuo baako aname enu baako ye for a day and it says zinc o mu dey once ankoto zinc foforo
okay. But it depends on the amount of zinc in there. Okay. You can add more zinc to it. Okay. So ufa this I can say 20 to 60 milligrams. Okay. So ufa products now the amount of zinc you can add on to say you get to about 60 milligrams. That is
absolutely. For all too soon. The Jumadi no ban away ye. Doctor on Kasakeke, or we are was a tray and your my see ye. Ya dear no, I hu. Nanso, your boy who by ye, near dear huni ye, and you da. Young and I free side Jumadi swa, as you call your storerooms near Ryan, ye just a baby ada, ya, and one to me could sit down for said I cannot now, as you call ye, honey, ye, just a word be a near, oh fear. Ebika now full say untumi nni a omode ane fa ko fridge mu kama package ne kama fa wura fridge mu memma kwan mankura emetu atese wo kitchen ne medie aduane no fi se na no ka o de ka aduane no a udi a Lassa Fever o bi a wonso ubenya bi na sa de wo ka no yade a ehu kakra cause a virus na ne hard drink kakra ne say omunya vaccine bia ma sa virus omuguso ye hwehwemu die nanso emai ti se wunya anhwe ni ya na wa break kakra na wonkwa so wunya pe na de asan ufiefuo nyina enti mesre wa to aduane wa bonten ene omo no aduane abonten so ye besre mo ni de fo se maame ya wunya ayewo mate se wo che bayire oton aduane ena wa hwere ne nkwa ya efiri Lassa Fever ho ana se Lassa Fever ho enti ya de ese me no mienu a yehwe ne ye ma ye asemhia mo me nya ma ban we abanya aban na ebe ye yen ankasa ankura yedi ye huni a yade no onya he nda masese ne nso monya aso na matie me na monya ani nso na mo de ahwe dwumadie mo nkoso ahwe na wo hwe nso a na wo hye abusia mintimi sign off keka me ma Dr. Kwan no fa na futu sem tiawa his final words of encouragement no fa mama no mienu na yen fa ntie kutudwomu fa moye bra Doctor your final words.
Okay, so other mechanisms here the WHO and CDC they've come up with some of the other friend the community hygiene because able to me I'll fight against this area. You have to come together as a community and fight against it because usually we have communities we have a lot of rats all over near usually and yet obi kwa fie who's a free now, you notice that in a particular communities, you have a lot of these rodents around. In that instance, say you already started to spread, it will spread from this home to another home. Because the whole community has to come together to fight it. So communities coming together to ensure that ensure sanitary conditions in their community. So the weeding around, ensuring that rubbish near that they dispose the rubbish at the appropriate places. As a community, so when you be you all come together to help the person. Say be in the storehouse anyway, say if you are not until some information we can now almost what didn't when you say be or no better and spread, because if you are in the community, you just say be a found, but obi baka kunya you even know oba cry be house man or maybe I'll school and I maybe obaka the circle can be an share come into contact with one of these people. So you can say it's a community fighter. As a community, you all have to come together and then fight this virus by maintaining high sanitary conditions. Very important.
Yo, Doctor, ready? You better say, so what do we aba yakramo?